Hello and welcome to the female reproductive system. How exciting is this? You know it is. Okay, and this is our last live chat for our course. I will remind you again at the end, but please remember that I am in the course 7 days a week and in email 7 days a week. So if you have a question, don't hesitate to ask. I promise you a response within 24 hours. Okay, so let's get going, huh? The breast is considered genitalia. And as you know, it sits toward the top of the torso. And on top of the pectoralis major muscle. Men have them as well as women, and which is why men should be aware of going to the doctor because 10% of all breast cancer cases are men's breasts. Yes. Okay, but men do not have the workings within their breasts in order to produce milk during pregnancy and breastfeeding. Okay, sorry. All right, there's got to be a difference, right? All right. So what you need to know is the axillary tail. Remember the axilla is your armpit. And of course, the nipple that protrudes from the center of the areola, which is the colored part, the different color part. And men have those as well. And the circle of, and that is the circle of different, sorry, I'm a little discombobulated today. I apologize. Okay, it must be the post-Thanksgiving turkey weird stuff, right? Can you believe today is December 1st? I don't know where this came from. Okay, so you want to be aware of the axillary lymph nodes. Again, remember, axilla is the armpit, so that's going to be this part. And hooray for innovation, because 30 years ago, if the breast cancer spread to the axillary lymph nodes, that was the end. There was nothing to be done for the patient. And now, of course, that is no longer the death sentence that it used to be. And in the United States, we have a 95% survival rate of breast cancer, which is phenomenal. Okay. You have fatty tissue, which gives the breast the size and shape. You have the lobules, which are those mammary glands that do the production of the milk during breastfeeding. And then that travels down. You can see the little gray lines. So they feed that milk down to the nipple. We already discussed the areola, the ducts that carry the milk. That's those gray lines. And of course, the nipple, which is the nipple. Okay, interesting. It's the same word on a breast as to whether on a bottle. Okay, fibrous tissue supports the breasts and makes them feel firm. And any woman who has a lot of fibrous tissue in their breast knows that when they go to get their mammogram, because it just makes it a little more challenging to get a good vision. But let's remember that now with digital mammography, the pictures are much clearer, and the whole point is to identify breast cancer at the earliest possible point so that it is at its most vulnerable to the accomplishments of science and we get survival. Okay. All right. Internal female genitalia, bottom half. All right. The ovaries, which contain the eggs, the ova, okay? Then we have the fallopian tubes, which are the superhighway between the ovaries and the uterus. It's also where Mr. Sperm meets Miss Egg, and if possible, if wanted, hopefully, they make a zygote. And then the zygote will travel the rest of the way down the fallopian tube to implant in the wall of the uterus. Now, it's interesting because fallopian tube in the average woman is only about 4 inches long. And now that you know that Mr. Sperm and Miss Egg meet up in the fallopian tube, that also explains why sometimes we have an ectopic pregnancy. Ectopic is the medical term for outside of where it's supposed to be. So, of course, the fertilized egg, the zygote, is supposed to continue traveling to the uterus. However, sometimes it gets stuck in the fallopian tube. And at that point, it must be surgically removed, because otherwise, if the zygote continues to grow, you can imagine that little tube is not going to be able to handle an embryo, much less a fetus. And that will then burst the fallopian tube, cause all kinds of havoc, and can actually cause the death of the woman, not desired. Okay. As we travel, remember the endometrium is the lining of the uterus. That is where the blood is expelled during menstruation. And we come down to the entryway, if you will, or more appropriately, the neck of the uterus, the cervix. And if you remember when we were talking about the skeletal system, you remember that the vertebrae up here are called cervical vertebrae. And that's because cervical or cervix is the Latin term for neck. So this is a neck. You already know that, right? And that is the neck of the uterus. Maybe that will help you remember, okay? So women have 2 cervical areas, whereas men only have 1. Very interesting, right? You're going to take that to the next Christmas party, aren't you? Yeah, okay. All right, and then that leads to the vagina, which eventually goes to the outside of the body. Okay, so this is the confabulation for the processing of eggs, and they're traveling to the uterus. Now, if the egg travels through the fallopian tube and there is no sperm to fertilize it, it will continue to the uterus and then be expelled with menstruation. If it is fertilized and it becomes a zygote, then it implants in the endometrium, the wall of the uterus, where it will stay and grow zygote, embryo, fetus, baby. Okay. And now we have the external female genitalia. We start out with the vulva, and vulva are the lips of the female genitalia. And mons pubis is that mound of fat. It's adipose, sounds better than fat, right? That's the hairy part, and that's there to just protect the general area, okay? Right below the mons pubis and above the labia is the clitoris. And then you have the labium minus and majoris, minora or majora. okay? The minora is the internal part of the labia, and majora is the outside of the labia. And within there is two openings. One is the urethral opening. And remember, the urethra leads directly to the bladder, the urinary bladder. And then we have the vagina, which is the opening to get into through the cervix, uterus, fallopian tubes, ovaries. Okay. And sometimes there are new methodologies for doing procedures that will use a natural opening, and that's exactly what it's called, a natural opening, such as the vagina, that physicians will use that as an access to get to that ectopic pregnancy in the fallopian tube, or if the doctor is going to perform tube tying for a temporary blockage of the tubes so that the eggs cannot pass through, so the woman cannot get pregnant. Also, hysterectomies, salpingectomies. Salpingectomy is a removal of the fallopian tube. Oophorectomy is the term used for removing the ovaries. And of course, hysterectomy is the term used for removing the uterus. Okay? All right. Now, gestation. This is how it works. First trimester, day 1 up to 13 weeks, 6 days. In other words, less than 14 weeks. Second trimester starts on the first day of the 14th week and goes through the completion of 27 weeks or less than 28 weeks. The third trimester, 28 weeks until it's a baby. Okay, that's what I wanted, a smile. Thank you. I appreciate that. Okay. Now, you probably have heard terms such as a preterm or premature neonate. A neonate is a born baby that is up to 28 days old. 28 days old or younger from the moment of birth is a neonate. Neo being Latin for new. That makes sense. Okay. A premature neonate is a third trimester birth, but before getting to 37 completed weeks. So we have 28 weeks to 37 weeks, and the baby is born. That is considered a premature birth. Okay. Post-term, and yes, there are babies, fetuses that are so comfy and cozy in there, they don't want to come out. Oh, and then mama has to walk around like over 40 completed weeks, up to 42 completed weeks of gestation. 42 completed weeks of gestation would be a post-term neonate. So for those of you who are figuring this out, 38 to 40 weeks is the normal amount of gestation. Before that, premature. After that, post-term. Now, premature births can cause some lasting effects for the baby. Most often, respiratory issues, because the lungs are the last part of the fetus that develop. Okay. And prolonged gestation of a neonate over 42 completed weeks, and why this baby is not being induced, I don't know. But that's between a woman and her doctor, period. That's okay. So it is important, no matter what position you are going to hold, whether you're going into nursing or medical assisting or coding and billing, these are important measures, important terms that you must know and understand. Okay, and now it's time for the big event. Yay! Yay! The baby's coming, the baby's coming. And hopefully in a proper sterile area and not the back of a car. Okay, so gravida is the Latin term for pregnancy. And you may see on a patient's chart gravida or G, just the letter G with a number. If you look at the bottom of the screen, you see gravida and para may be noted using abbreviations such as G2P1. Para is the number of babies this woman has given birth to after 20 weeks gestation. So when we go back to the bottom of the slide and you see G2P1, that tells us that this woman has been pregnant once. I'm sorry, I apologize. Pregnant twice and given birth once. So what does that tell you? If the woman is pregnant right now, that tells you she's pregnant with her second child. If the woman is not pregnant now, that tells you that she was pregnant twice, but only gave birth once. So perhaps there was a miscarriage, which should be noted somewhere in the documentation. And then we have A for abortus, which is the medical term for a pregnancy that did not come to term or make it past the 20th week. This has nothing to do with intentional abortion or natural abortion, which we know as a miscarriage. Okay, this is no political judgment or value judgment or religious judgment. This is just a fact. The woman had a fertilized egg, it implanted, it did not make it. And the reason why this is important to note on a patient's chart is because women trying to get pregnant who have had multiple miscarriages is something important for the next doctor to know. Okay, so women will see these notations in their chart, and if you look at the little illustration next to it, the far right is the proper birth position. The baby should be coming out head first. The illustration on the left is a baby formerly known as breech. Okay. Sometimes the physician can, from the outside, externally manipulate the baby and turn him around. Sometimes they have to go in through the vagina and do it. And sometimes this baby needs to take the emergency exit known as a C-section. Okay. All of this must be documented. It all must be reported. This is very important. Okay. Not only for the documentation and the current and future health of the woman, but for the baby as well. And just so that you know, the minute the baby is born, the baby gets its own healthcare record, its own chart. So the minute that baby clears the runway, it has its own chart, and anything having to do with the baby will be documented on the baby's chart and not on the mother's chart. The last notation on the mother's chart will be what is known as outcome of delivery, which will tell us how many babies alive or not alive, and born in a hospital or not in a hospital for the coding factor, okay? Anything having to do with the very first item on the baby's chart is that the baby was born, and then go from there, okay? So that's very important that you understand the minute this baby clears the runway and is born, the baby gets its own chart, okay? All right. Any questions? All right, you got to review these words often. You have to use your medical dictionary so you are remembering accurately, and query when necessary. When you're in your class, that's email me. Okay. When you are on the job, there is no reason to be embarrassed because it actually is written in the law. You are required to query when necessary, when the documentation is incomplete, when the documentation is ambiguous, and or the documentation is contradictory. Okay. All right. So get ready for your final exam. Yay. Make sure you take the practice exam to make sure that your technology is working. You don't need that interfering with your grade for the final, okay? As you're studying for the final, any questions, any clarifications, anything in your head that goes, why is that and not this? Email me. I will explain it to you, okay? And anything else that you need. That is my email. Remember, the email in the course list is not the correct email, and it ends up somewhere in one of the rings of Saturn. If you want me to actually read and answer your email, you have to use this email address, okay? All right. Have a wonderful week. And I am here, even though we're not going to have any more live chats. If you want a one-on-one to talk, I'm fine with that. Email me. Otherwise, I'm here for you, babes. Okay? Have a great week. You guys can do this. Yay!